Yeah. Okay, now we're recording, so it's okay to put you on video and internet.
Yes, it is.
Okay, so you were, how was your experience when you through admissions?
Admissions was no problem whatsoever. I'm Canadian from Ontario, so OHIP is footing the bill for this. So once they heard that, it was just, I think I signed a few pieces of paper. And last Tuesday in clinic, I had to go and see the pre-op nurse, and that took about 15-20 minutes. And I attended clinic with the others, and there was no problem. And then I was given the opportunity to stay in a place other than a hotel. It's called Willow Creek at San Martin, and it's a assistive living facility. And it was absolutely phenomenal. I didn't have a room. I had an apartment, a one-bedroom apartment, which was really nice. Beautifully decorated. It's a new facility. I think they told me they've been open just since November of last year. And I hope it works out for Dr. Rutledge and his patients that they use that in place of any of the hotels, unless the patient has a particular desire to go to one of the hotels. I would recommend this facility because they have medical people on staff. They have a beautiful dining room with a fully qualified chef. They'll prepare just about anything you want for your meals, pre and post-op. So it's been an absolutely positive experience. I had more bypass done this time. The first time it was just under 3 feet, I believe, and this time it was 6 feet. So I'm hoping that'll take the rest of my excess weight off.
How was your recovery this time compared to last time? Do you remember is there any difference, or?
The only difference was both times I don't remember being in the recovery room, but I know I must have been, obviously. Both times my first recollection is waking up in my patient room. This time I had the drug interaction that made me a little fuzzy-headed, shall we say, and I did some hallucinating. And I was a little confused. I kept saying, well, I'll go for surgery tomorrow, but I'd already had the surgery that day. And Dr. Rutledge explained that that was the combination of drugs and how it affected me. Apparently there was one other patient that day, Louis, who also had a little bit of fuzziness in his head, but it doesn't hit everyone like that. So.
Right. So when you went back to Willow Creek, did you get to see a nurse? Did she come by, or did they leave?
Oh yes,
pretty much?
Nurse and doctor.
Okay, so the doctor and nurse, did they come by every day, or just the first couple of days, or?
They made sure somebody, if they didn't see me, like in the main area, in the lobby, or in the cafeteria, or the dining room, they'd send someone to my room just to say, are you doing okay? Do you need anything? And they give everybody, including myself, a pendant to wear, so that if I did need some help, I just had to push a little button that I wore around my neck on a chain.
Oh, that's great.
And within 3 minutes, there's someone at whether you're in your room or a different part of the facility, they can GPS you and find you wherever you are. So if you need anything from a cup of tea to emergency medical services, they're right there for you.
Great. And so, and you also had a ride to and from the hospital from them, so you had transportation.
Anytime I needed to go somewhere, whether it was the hospital, and one day they even took me to drop me off at Walmart for a couple hours. I needed to, just get out of the 4 walls. Plus I needed to pick up a few supplies. So they dropped me off and I said, can you come back in 2 hours? And the fellows came back in 2 hours.
Did they accommodate you with the MGB Diet? Were you able
yes.
to, did they have that for you available?
Absolutely. They had at least 2 kinds of soup each day. They have yogurt, they have lots of crackers, they have Gatorade. I don't drink it because the sugar in it is too hard on my type 1 diabetes. It really puts my blood sugar through the ceiling. But definitely they have, other things. I brought in some green tea of my own just because they didn't happen to have it that first day, because I was their first MGB patient, so maybe they didn't have everything. But they certainly could get me what I asked for after that.
Okay, great. So your experience in all was a 1 to 10.
Oh, it was a 10.
10. Oh, great.
Yeah, I have no negative comments either on my surgery, the hospital, the cloth staff, or the people at Willow Creek.
Okay, thank you, Ellen.
You're welcome.
Okay.
Thank you.